I think on the surface, clinical psychology is the field that focuses on assessment, diagnosis, and treatment of mental, emotional, and behavioral disorders. It involves things like psychological assessment, evidence-based therapy, research and scientific thinking, ethics, diagnosis, and cultural competence and humility. But I think as the years that I've been a psychologist, really what it comes down to is being the type of person that can sit with another person as it relates to human suffering. What I keep learning time and time again as a psychologist is not just what it means to figure out a private practice, learn all of the ins and outs of things like acceptance and commitment therapy, cognitive behavioral therapy, all the ins and outs of different assessment as relates to personality disorders or even neuropsychological testing, not even consulting or even teaching or research or stats, but it's really my capacity to sit specifically with human suffering. The thing that I don't think really anyone can fully prepare you for in this field is that you will get exposed to all different sorts of suffering from all different types of populations, from children to adolescents to young adults to geriatric populations, to even all the different types of conditions like anxiety, depression, PTSD. But you will just hear some unbelievable suffering moments. And I think there's times where for me in my career, I've thought to myself, I don't know how one person can continue to endure what this person has gone through. And there are so many nights where I leave the therapy room, I leave to go back home, and there are stories that sit with me to this day. In this field, you learn how culture can shape an individual. You learn how systems fail people, because whether it's because of capitalism, whether it's because of institutional barriers, whether it's because of healthcare, whether it's because of family upbringing, you learn how motivation is built. And how, when it comes to behavior change, someone going from a destination of A to B requires so much level of intricacy and delicacy and patience and really meeting people where they are. Yes, you're going to be trained in suicide risk assessment, trauma narratives, chronic pain. But really, I think the biggest training that I've learned is really the training of being able to sit with another human being, to lean into their suffering, to lean into being able to tolerate uncertainty and not looking for those quick fixes that we learn in graduate school in terms of evidence-based theories. And I think that's one of the biggest takeaways that I've had from this field is that it's not just about therapy. It's not just about assessment. It's not just about the clinical skills and the research and the stats. And all of those things are important, but really the nuanced learning that I don't think anyone can really teach is to understand people, understand yourself, but understand the complexity of suffering. My name is Dr. Phil Sarpon. I'm a psychologist. I help students to get into graduate school and also to be successful in their early career. This channel is dedicated to all things psychology, wellness, and graduate school. If you have not already, please subscribe to the channel, like and share this video, and stay tuned for other videos that we're going to do in terms of mental health topics. And with that, I hope to see you all in the next video.